Good morning, Major Thomas. So,
Morning.
you've been here with us at Medanta, and we have a few questions for you. So, can you describe what happened the day you first experienced your symptoms?
On 24th night in the evening, I ordered some food from outside, and somehow late in the night I started getting very severe headaches and resulted in vomiting and loose motion. So I thought it was a food poisoning issue, and it might just pass through the night. But through the night and the next day it didn't improve, or my condition continued to be severe. So then I visited Paras Hospital nearby, which was close to where I stayed, to get some treatment.
Okay, and after that, what happened?
After that, once we reached the hospital, they treated me for the food poisoning through the internal medicine department there. Yet my headaches were not reducing, it was getting worse by the day. So after a day or two in the hospital there, then they asked me to get an MRI done, a CT scan done, and then they discovered that I had a SAH problem, and then a subsequent MRI done, which established that I had an aneurysm in my brain.
Okay.
And then the option of what to do for it was clipping or coiling was taken. My family and friends, took opinions from, doctors they knew. They decided that coiling was the best option. But that hospital where I was didn't have a coiling team. They were ready for a clipping, but we insisted that coiling was then had to be done. Subsequently, we found out through friends and family that Dr. Goel, Gaurav Goel in Medanta was the best suited to do this. And we reached out to him, my friends reached out to him, family reached out. And then on that Sunday, which is 29th of March, I was discharged from the other hospital and came to Medanta. Around 4:30, they, took me in. I was incubated and 8:30 I came back, gained my consciousness.
Okay.
And the pain that I was suffering through for the past, from 24th to 29th, the throbbing wave-like headaches which were becoming unbearable, after that procedure went away. But then there was this nagging headache still, which took a couple of days more. I was discharged back to the room, and took me another 4 or 5 days to clear that headache. And today, on the 8th day after this procedure, my headaches are completely gone. Yes, there is some medication around it, but my headaches have gone. I'm back to usual routine. I'm eating well. I'm able to read, write, and do all those functions that I'm looking forward to going back and get back to my daily routine.
So, when you were told that you had a brain bleed, what was going through your head at the time?
I knew there was something, wrong or bad happening in the head, because that headache was not normal. It was very severe. And in my life, I had never experienced such pain and some headaches of this nature. I was apprehensive, and I knew it had to be done. How I got through those days of severe pain was I had no choice. The doctors were giving me pain medication, but that was not really alleviating my pain, where I would do my breathing techniques, which I normally do at home. I used to do long inhales and exhales to sort of manage that pain, in addition to the medication they gave me. And that sort of worrisome, hugely. But then I knew I was in good hands, and this eventually would take care of it. And Dr. Goel, I had heard about him, and I was confident that he would help me get through this pain.
So, is there any doctor, nurse, or staff member that you would particularly like to thank?
No, I think in Medanta, the entire staff, Dr. Goel, thanks to him and his intervention timely on a Sunday to come and do it, was hugely, I'm grateful for that. And every nurse, every sister, every staff, they were all good, helped me manage that pain through the days. And of course, my family and friends who helped me out through this process.
Okay. And what message would you like to share with people if they ever experience a sudden severe headache or similar symptoms?
I think headaches can be misjudged, can be taken for granted that it's just a headache and pop a few pills. But if the headaches don't go through normal headache painkillers like Dolo 650 or paracetamol, one should immediately go to a doctor or a hospital and then get their necessary examinations done. Otherwise, I was lucky because I think from 24th when I experienced this severe pain till 29th when the procedure was done. Anything could have happened. That aneurysm, as I now know, could have burst, and it could have been a very fatal sort of situation that could have arisen. So don't wait. Go to a hospital, go to a good doctor, get the examinations done, and get the treatments be done as fast as possible. In my case, at age 60, I'm physically fit. My vitals were all normal. I have no blood pressure, no diabetes. Probably that helped me, get through that stage. And today I'm grateful to the doctors and the hospital of Medanta for having got me through this painful period.
And how does it feel to finally be going home today?
Hugely thankful. I'm looking forward to eating some good food. Hospital food can be very bland and insipid. But to get back to my routine, I walk daily, I exercise and play my golf as soon as I can and get to the golf course and start playing. So feeling very fresh and rejuvenated. Past 14 days was horrible. No one should go through that. And thankful to Medanta for having got me through this stage.
Thank you so much.